Hello and welcome to this afternoon's elected member webinar on the COVID-19 National Violence Against Women Guidance. For those of you who don't know me, my name is David Barr and I lead on the elected member development work at the Improvement Service, and I'm going to be your host for today. This is an important topic, and I know from discussions with elected members that there's a lot of interest in this, particularly in finding ways to support women, children, young people affected by gender-based violence. So today's webinar is going to explore the key risks that women, children, young people face in terms of gender-based violence and are likely to experience in the short, medium and long term. We're also going to look at the key role that you as elected members will play in this, and we're going to explore the contents of the National Violence Against Women guidance that has been published on COVID-19. So joining me for today's webinar, I've got three speakers, and I'd just like to introduce you to them just now. So firstly, we have Katie Brown from COSLA. Katie, would you just like to introduce yourself?
Hello, I'm Katie Brown. I work as the COVID-19 and Violence Against Women and Girls Policy Manager for COSLA.
Thanks very much, Katie. And Joe from the Improvement Service. Would you just like to introduce yourself, Joe?
Good afternoon, everyone. I'm Joanne McLaughlin from the Improvement Service. I coordinate the National Violence Against Women Network, providing support to local multi-agency violence against women partnerships across Scotland.
Thanks, Joe. And finally, we have Katie Cosgrove from Public Health Scotland. Katie, would you just like to introduce yourself? I think your microphone's on mute.
Good afternoon, I'm Katie. Good afternoon, I'm Katie Cosgrove. You hear me now?
Yes, we can hear you now.
For the first time, good afternoon. I'm still Katie Cosgrove. I'm the Gender-Based Violence Lead for Public Health Scotland.
Thanks very much, Katie. Just before I hand over to Katie Brown to take us through the start of today's presentation, I would just like to take you through some virtual housekeeping. First things first, we're all going to turn our webcams off from now on, and we're all going to reopen them back up again at the Q&A after the presentation. So that's just so that you can focus on the presentations as they are on the screen and not distracted by anything else. So the virtual housekeeping for today, the first thing I'd say is the session is live, as you can tell, and we are recording it. The recording is going to be made available on the Improvement Service website sometime after today's session, so you can refer back to that. We're planning to run till about 3:45 this afternoon. If there's a deluge of questions, we may extend that slightly, but that's roughly what we're expecting to do. And in terms of asking questions and engaging with the speakers, you'll all be on mute for the entirety of the webinar itself. So what we want you to do is to use the chat function, which is in the menu, which is usually located on the right-hand side of your screen. So if you can just put any questions that you have into that chat function, I'll pick them up, and then once we're through with the presentation, I'll be putting a selection of your questions to our presenters. Don't worry if we don't get to your question today. We will provide a response to all questions, so please ask away using the chat function. We'll pick them up. You will definitely get a response, so ask away and I'll put them to the speakers at the end of the session. So on that, I'm just going to hand over to Katie Brown to take you through the first part of today's presentation. I do hope you enjoy it. If you have any technical issues, again, use the chat function. I'll pick that up throughout the course of the session and help you as best I can. Katie, on to you.
Thank you very much. Good afternoon, everybody. I'm delighted to be speaking with you today. Violence against women and girls in any form has no place in our vision for a safe, strong, successful Scotland. It damages health and well-being, limits freedom and potential, and is a violation of the most fundamental human rights. The Scottish Government, COSLA and key partners are committed to preventing and eradicating it in all its forms once and for all. This was our commitment pre-COVID and continues to be so now. Equally safe is Scotland's strategy to prevent and eradicate violence against women and girls, and it is jointly owned across our spheres of government. And together as partners, we work with a broad range of key stakeholders from across the sectors, organisations and agencies, including our third sector frontline experts, together to achieve its ambitions. Preventing...
I'll just stop you for a second. I'm not sure if the participants are able to see your presentation at the moment. I think it's just showing you the desktop.
Oh, I don't have slides for my presentation. Sorry.
Okay, that's fine, actually, it's not a problem. What we can just do is you can take off your screen for the duration of your segment. So that's fine. Apologies, I thought you had some slides there.
No, I don't. Sorry. Right. Okay. So is that off now?
Yeah, that's perfect. Thank you.
Okay, apologies everybody. Also, I just want to quickly apologise if you hear a strange clicking. I have a bit of a problem with my microphone. Just bear with me. Thank you. So equally safe is Scotland's strategy to prevent and eradicate violence against women, and it's jointly owned across our spheres of government. Together as partners, we work with a broad range of key stakeholders from across sectors, organisations and agencies, including third sector frontline experts, together to achieve its ambitions. Preventing and protecting women and girls and their dependent children from the harms of this perpetration of violence, control and abuse in the context of current or previous relationships. Supporting the recovery of those whose space for personal action and safety has been limited, and to ensure that a stable and safe life without abuse can be achieved and maintained, while holding perpetrators to account for their choices and behaviours, requires a strong multi-agency commitment and action, and it has never been more important to do this than now. Your local authority violence against women partnerships are therefore the key engine coordinating and driving forward this work across cross-sectoral services and multi-agency partnerships that sit locally at the heart of success. Again, this was the case before COVID-19 and remains so. Increased levels of domestic abuse during this pandemic have been constantly reported globally. Lessons learned from China, Italy, Spain, France and Australia and others, along with evidence gathered through and from other epidemics and disasters, tells us that levels of gender-based violence continue to increase in and through emergency response phases, to recovery phases and into rebuild. We cannot relax on any point of this journey. The impact of coronavirus on the gains made to date on women's equality is damaging and challenging, and the prevalence of violence against women and girls is inextricably linked to this. Currently, here in Scotland, data and intelligence from frontline services is confirming that under lockdown conditions imposed to control the spread of the coronavirus, home is not a safe place to be for many. COSLA leaders have stated that their highest concern currently is assuring the safety of women and children living with domestic abusers in isolation. Additionally, there is also concern about increased risks to women engaged in commercial sexual exploitation and prostitution. Here, the danger of contagion, violence, and sexual coercion are extremely high, and the lack of social support and connectivity to services leave women and young people vulnerable to poverty, risk of homelessness, and destitution. Therefore, COSLA leaders agreed at the outset that a consistent, coherent approach at local and national levels was required to mitigate the impact of public health measures to suppress virus transmission. COSLA and the Scottish Government, in the context of our Equally Safe partnership and in tandem with the Improvement Service and Public Health Scotland, has a key role in providing leadership and engagement across a range of national and local organisations. And this is why the new supplementary COVID-19 Violence Against Women and Girls guidance for local authorities and their community planning partners has been developed and launched. This guidance will support efforts to protect women and children from domestic abuse and commercial sexual exploitation and other forms of gender-based violence, and will assist services in identifying and responding to risk in the context of these unprecedented times. These are challenging times for victims and survivors of gender-based violence. And while local authorities are working really hard with partners to offer help and support to those who need it, we have to recognise that services under the current pressures that we are facing cannot be wholly confident at all times that we are able to reach out to all those who need help. Inevitably, support is more limited, and there are individuals and families, particularly women and children, who are currently living in very challenging, coercive and controlling circumstances in every community. Your leadership role as an elected member is key to how we go forward. We really ask you to promote the knowledge of and to use this guidance with your energy to ensure that key decision makers understand that the guidance has been developed to support their already strong leadership and their already strong commitment to local area implementation already. Tackling violence and abuse through strong cross-sectoral and multi-agency mechanisms is already successful across our local authorities. This guidance has been put together to support and to connect all of those systems as we move forward through this COVID challenge. We need to ask you to continue to work together to support victims and survivors in the current crisis by ensuring that you are in touch with your own local Violence Against Women partnership. Please make sure that you are up to date with the current trends in your own area in regard to domestic abuse and CSE and other forms of violence and abuse, and that planning is underway for the intermediate term to make sure we are responsive to the emerging needs. That now finishes my section, and I will be very happy to take any questions later, but for now I thank you all, and I will pass over to my colleague from the Improvement Service, Joanna McLaughlin, who will tell you more about this guidance. Thank you.
Thanks very much for that, Katie. Now just handing over to Jo to take us through the next part of the presentation.
Thank you, Katie. Thank you, David. As Katie mentioned, yesterday the Scottish Government and COSLA formally launched supplementary national guidance on supporting the needs of women and children affected by violence against women during the COVID-19 pandemic. I'm very conscious that most of you won't have had an opportunity to read through the full guidance yet. So what I was hoping to do this afternoon was just provide a brief overview of its contents and highlighting the key role that you could be playing as an elected member in promoting it locally. The guidance was developed by COSLA, the Improvement Service, Public Health Scotland and the Scottish Government in consultation with a wide range of local and national organisations. This included third sector and public sector representatives from local violence against women partnerships, as well as professional bodies. It's designed to be a useful resource that can support elected members and other key decision makers to ensure that the safety needs of women, children and young people experiencing violence and abuse during the COVID-19 pandemic are prioritised at a local strategic level. The guidance itself is split into 6 sections. The first 3 sections highlight key risks and mitigating actions for decision makers to consider during, firstly, periods of lockdown, such as the one that we currently are experiencing. Secondly, once lockdown is lifted and we move towards recovery. And finally, as Scotland begins its transition to the new normal. We were very conscious when we were asked to develop this guidance that a lot of the guidance that's been published to date quite rightly focuses on the immediate crisis and ensuring that needs are met during lockdown. But this guidance, while highlighting that, is also intended to support the next stages of planning and recovery as Scotland starts to transition to the new normal. There's also sections in the guidance highlighting key messages that partners may want to consider communicating at all stages of the pandemic, both to women and children themselves, perpetrators, and the larger workforce and communities, with our key theme of tackling violence against women and girls is everyone's business. There's also a section on the importance of data in ensuring that we understand and can respond to the impact of COVID-19, and my colleague Katie Cosgrove will be talking more about that in a moment. And finally, there's an appendix at the end highlighting other guidance that's been published to date that is likely to have an impact on women and children affected by violence and abuse. And we were very clear that we don't want to be creating additional guidance, but really we're hoping that this, by having it as a live document, can be a one-stop place that people can go to keep up to date with the range of guidances that are being published over the coming weeks and months. When we publish the guidance, there's a full guidance which is around 35 pages, but there's also a short executive summary, and it's the executive summary that I'm going to be focusing on this afternoon. And the executive summary is designed to be more of a checklist that decision makers can work through, and it really focuses on some of the key risks and mitigating actions at each stage of the pandemic response. But both documents are very much intended to be read together. So, for example, each of the risks in the table that I'm about to talk through has a corresponding paragraph in the full guidance. So there's more details available if anyone wants to read them. So just beginning with the first section of the guidance, it aims to highlight key risks and mitigating actions during periods of lockdown. As Katie Byrne has already mentioned, we're very aware that home is not a safe space for many women, children and young people at the moment. So in terms of making sure that the safety needs of women and children affected by domestic abuse, sexual violence and abuse, FGM and at risk of forced marriage are met, it really highlights particular risks that they may be experiencing during periods of lockdown. So, for example, increased barriers to accessing support and emergency housing. The key risk that perpetrators of abuse may be increasing their levels of control and surveillance during periods of lockdown because they may be under the perception that they can be getting away with it. And also highlighting that children and young people might be particularly at risk while schools are closed, and they may be less visible to agencies and services who aren't able to identify and respond to signs that they would otherwise be able to. And we're very clear with this guidance that while domestic abuse is a key risk and there's significant heightened risks to women and children experiencing domestic abuse, there's also risks of all forms of violence, in particular sexual violence, exploitation of children, online abuse and grooming, and FGM. There's also sections in the guidance looking at prostitution and other forms of commercial sexual exploitation. As Katie mentioned, we've been hearing from service providers that women are increasingly at risk of being targeted to sell sex both online and being pressured to sell sex in person also. This can lead to increased risk of infection and putting women and children at increased danger. These women might not be able to access the same safety mechanisms and support during periods of lockdown that they were able to previously. The guidance also highlights that while all women and children are at risk during this period, there's additional risks to women with complex needs or multiple needs. So, for example, social isolation may exacerbate existing mental health issues and trauma that survivors of violence and abuse may be experiencing. We know that women in the criminal justice system who are released from prison during lockdown may receive less support than they would otherwise be able to as part of their through care pathways. And there may also be decreased access to services for women with problem alcohol and drug use. So we're encouraging partners to think about the complexity of vulnerable communities and how they may compound the challenges that they're facing in this time. And finally, there's a section on perpetrators. Again, we realise that perpetrators in the criminal justice system who may be released from prison during lockdown may pose increased safety risks to the families that they're returning to. Also, perpetrators who are convicted of domestic abuse charges and other things may face challenges remaining engaged virtually with programmes and support services that have been put in place. The guidance is very clear that this isn't about just identifying risks, but highlighting what are the key actions that decision makers should be looking to undertake at this time. So some actions that elected members can have a key role in supporting is that ensuring MARCs are continuing to function, to identify and ensure safety plans are in place for women and children at the greatest risk of harm during this period. And that particularly includes women and children at risk of being murdered during and after lockdown. Other actions include supporting councils to ensure that robust domestic abuse housing policies are put in place. And Scottish Women's Aid has produced fantastic guidance in collaboration with other partners on what good practice looks like in relation to that. There's also a key role in considering how to support and enhance the capacity of specialist services who have had to quickly transform a lot of their delivery models from face-to-face services to providing digital support. And a key way that elected members and other decision makers can be supporting them during this period is being flexible about how funding and existing contractual expectations are used to allow them to respond to changing needs. And a particular issue which Katie has highlighted is the key role that elected members can be playing in encouraging all community planning partners to work together to ensure that there's a joined up person-centred approach to meeting the needs of women and children. And that might include ensuring that strategic partnerships working within adult protection, child protection, criminal justice, alcohol and drugs, and community safety are collaborating with violence against women partnerships during this time. And finally, the key role of ensuring that quality impact assessments are regularly undertaken when developing any new policies and pandemic responses to make sure that there's no unintended risks posed to women and children, and particularly women and children who may already experience barriers as a result of protected characteristics, such as women and children with disabilities. The second section of the guidance starts to think about key risks and mitigating actions once restrictions are lifted. And the key area of risk we've highlighted in relation to this is the increased demand for support that services are anticipating once lockdown's lifted. There's a particular risk to women and children who may be leaving perpetrators after lockdown, with research continuously highlighting this is when they're highest risk of serious physical harm, including murder. So it's making sure that support services are in place that identify and can respond to this heightened risk. We also know that prior to COVID, a lot of support services were already operating very long waiting lists, and that's likely to be even heightened when lockdown isn't lifted and we see spikes in demands for support. And this might be demands for support for both specialist violence against women services and trauma services, with trauma likely to increase during periods of lockdown. In terms of funding and capacity constraints, there might be increased challenges for service providers to meet this surge in demand because of their current limited capacity. And there's a key role that elected members and other decision makers can play in supporting organisations to anticipate what that demand is going to look like and look at opportunities to realign resources to see how it can be best met at a local and national level. So in terms of some of the mitigating actions, we've highlighted the importance of regularly consulting with women, children and young people with lived experience of violence and abuse to make sure that their recovery needs are met and really embedded in any long-term recovery responses that are being embedded at a local level. There's also a key role to ensure that local workforces have the capacity and capability they need to provide trauma-informed support for all women, children and young people who are likely to require it over the coming weeks, months and years. There's also a need to ensure that a whole systems child-centred approach is adopted when working with families experiencing violence and abuse, and that children are involved in decision-making wherever possible. And finally, there's a need to ensure that perpetrators continue to be held to account through the robust use of criminal justice processes and looking at how programmed interventions can come back online when it's safe for them to do so. Finally, the last section of the risk section of the guidance aims to identify key risks and mitigating actions as Scotland begins its transition to the new normal. And a lot of these are linked to previous risks. So in terms of looking at how we mitigate the long-term effects of the crisis on women and children. There's a key risk that instances of violence against women and girls will go undetected and unreported for many months and years. And again, that might compound the trauma and sense of isolation that women and children are experiencing. There's also particularly risks that the economic crisis could put women and children at an increased risk of harm, and that gender inequality could be further entrenched in social and economic systems. One of the key mitigating actions that we're encouraging elected members and other decision makers to consider is to think about how we can be capturing and building on good practice from crisis responses. We've been hearing multiple stories of how services are working together collaboratively, quickly redesigning and transforming services. And there's a real opportunity to ensure that that good practice isn't lost, but indeed that we continue to build on it as we transition to the new normal. And a key role to ensure that multi-agency collaborative working is at the heart of any future recovery responses. And where it's appropriate to do so, that we begin to move from crisis responses to looking towards early intervention and primary prevention, and looking at how we reduce the risk of violence against women and girls happening again, and work towards a Scotland where it's eradicated in the longer term. The guidance also has a key section on decision makers can help communicate key messages for women, children and young people at all stages of the COVID-19 pandemic response. So key messages that local authorities may want to look at promoting is making sure that women, children and young people experiencing violence abuse know that they're not alone and know the range of specialist support services that they're able to access both locally and nationally during and after lockdown. There's also a key role to make sure that perpetrators or potential perpetrators of abuse know that despite additional stress that they may be under, lockdown is not and never will be any excuse for harming women and children, and that they know that they will be identified and held to account for their behaviours. And finally, a key message around ensuring that everyone knows that tackling violence against women and girls is everyone's business, and that professionals working across a wide range of local workforces know the role that they can play in safely identifying and responding to risks that women, children and young people may be experiencing. And this is perhaps particularly important at the moment where professionals working in areas that they might not previously have been working in and engaging with members of communities in different ways may be coming into contact with women and children affected by abuse and may need some support to know how they can respond to a way that keeps women and children safe. The guidance also highlights the key role that elected members can play in ensuring that information on key national helplines available to women, children and young people are promoted locally, alongside details of other local support services available. And I've just highlighted a couple of the key national helplines, including Scotland's domestic abuse and forced marriage helpline. And finally, I just included a link to the executive summary and the full guidance. Thank you very much, and like Katie, I'll just take any questions at the end.
Thanks very much for that, Jo. I'm just going to hand over to Katie Cosgrove now to take you through the next part of the presentation. As I said at the start, if you've got any questions, please type them into the chat function. I'll be collating these and putting them to our three speakers once we get to the Q&A, so please do ask away. Also, I just wanted to point out we will be sharing the slides, so please don't worry about that. You'll get a copy of the slides via email after this afternoon's session. So I'd just like to hand over to Katie now.
Everyone. Hello again, everyone. I think Jo has articulated very well some of the key elements of the guidance, which I think provides very useful and very practical ways in which we can try to mitigate the worst impacts of COVID-19 at present and plan for the future. I suppose the key issue that I want to spend a few minutes talking to you about this afternoon is how will we measure that? How will we know that those actions are adequate? How will we know that they're consistently applied? How will we know that they meet the needs that are required? And who's going to be responsible for ensuring that we have that information? I think we probably all agree on the need for knowledge, information, data and intelligence to inform our understanding of violence against women, to help us develop interventions, to help us develop preventative measures in violence against women, and also to help us measure outcome. So what I want to do is spend a few moments just to look at some of the context for how we do that at present, and then consider some of the opportunities that perhaps this crisis has presented us with in taking that work forward. Oh, sorry, my screen's frozen. Currently, we derive data on violence against women from a number of different sources, and this won't come as anything particularly startling to any of you, I'm sure. Generally, we have the most reliable statistics we tend to have are the official statistics where violence against women is reported, usually through the criminal justice system. We also have a swathe of data that comes to us through reported violence and abuse to agencies, so administrative data that we glean from health services, from social work, from third sector organisations, from police and so on, that give us some idea of both at a local and a national level how our services are responding to and identifying violence and abuse against women. On a wider level, trying to get an idea of the extent to which it's reflected across the population, we tend to rely on survey data. And in the main in Scotland, that is around the Scottish Crime and Justice Survey, which every few years undertakes work to identify both the incidence and prevalence of violence and abuse against women and men, and to compare and contrast that with earlier years. All of those systems have limitations, as I'm sure you're very well aware. The key limitation is obviously that violence against women in all its forms is hugely underreported and underrecorded, so we only actually have a snapshot of particular aspects of violence against women. One of the key issues in relation to the continuum of violence against women that we're seeking to address through Equally Safe is that there is a disproportionate focus on some forms of violence against women as opposed to others. So, for example, we have a lot of information around domestic abuse. We know from the Scottish Crime and Justice Survey, for example, that only 17% of incidents around domestic abuse are made known to the police. What we don't have are comparable figures around sexual violence. So we assume, based on the low recording and low reporting levels to the police, that there's a lot of hidden sexual violence that is not disclosed in official data. In relation to commercial sexual exploitation and child sexual abuse, those figures reduce even more and are diminished even more. So we have a very skewed picture, even through the existing sources that we have violence against women on, of the different types of violence and understanding around that. And within that, again, we have hidden populations of women whose experience of violence and abuse can often be multifold, who experience violence and abuse over long periods of time, different forms of abuse, but we have very little information around that. So, for example, we don't have as much information as we could have around the needs and experiences of disabled women, of Black minority ethnic women, of migrant women, all of whom may experience additional disadvantage and marginalisation, and who are more hidden and invisible within services. One of the other issues that attends the difficulty in having accurate and reliable data on violence against women are the different definitions that are used across different agencies and different populations. So, for example, the National Survey of Sexual Attitudes and Lifestyle, which is undertaken every 10 years, conducted across the UK, found that 1 in 10 women had experienced rape since the age of 13, and 1 in 5 women had experienced attempted rape since the age of 13. They framed their questions in terms of non-volitional sex, so they asked respondents whether or not they had either had attempted sex or sex against their will. The framing of those questions are very different from the framing of similar questions in the Scottish Crime and Justice Survey, which found much lower levels of rape and sexual abuse in the population. And I think that begs the question of how we identify and agree on definitions of violence against women so that we are comparing like with like. I want to spend a wee bit of time just talking about administrative data, because those are the data that by and large will draw on at a local level to try and inform local responses in supporting the needs of women and children experiencing violence and abuse. One of the key issues that always accompanies any attempt to gather data from any agency is what the purpose of this is. Very often practitioners will ask why we need those particular pieces of information, how it's going to be used, how we can demonstrate its utility and its impact in helping to either shape our response or to measure outcomes. And very often we don't actually have clear answers to that. And what that sometimes results in is an attenuation of motivation for practitioners in gathering data and providing that at a local and a national level. So I think it's useful for us to restate the purpose of that. We need to know how violence against women and girls is being reflected in our services, how it's coming to the attention of the different agencies and how those agencies are responding to it. We also need to know whether or not they have the capacity to do so. So Joe had mentioned earlier the development of trauma-informed responses and ensuring that employees are able to respond appropriately and continuously to victims of abuse. We need to be able to gather data to understand the extent to which we have equipped our workforces to do so, and their comfort and confidence in being able to identify and respond to violence against women and girls. We need to be able to use those data to develop evidence-based measures and interventions, and to ensure that we target our responses effectively and appropriately. Without that information, it's very difficult to measure outcomes, it's very difficult to identify where we should target resources, and it's correspondingly difficult to engage with women and girls about what their needs may be. One of the other issues that is raised constantly is the issue of cost. There have been many studies on the costs associated with violence against women, most of which are hidden and are dissipated across different agencies. So we know there are economic costs. We know that there are costs around employment opportunities. We know that there's costs in relation to higher levels of poverty amongst women who've been experiencing abuse. We also know the cost for services in responding to violence, but we also have some understanding, albeit imperfect, of the cost of not responding effectively to violence against women and how it manifests in presentations to our services. So, for example, missing opportunities for early and effective intervention can result in long-term engagement with services with very poor outcomes both for women and for their children. So understanding how violence has been presented presenting in our services, understanding the nature of the local population and how their needs should be reflected is important in helping also to identify the resource allocation, particularly around budgets and staffing, to combat this. One of the difficulties at a local level in relation to data that I'm sure you've all encountered is the multiplicity of systems that exist, the difficulties in having systems speak to each other, as well as the difficulties that I've alluded to already around different understandings of abuse and the use of different definitions. There is a national performance framework associated with Equally Safe, which looks at trying to gauge the extent to which we've been able to progress the objectives of the strategy and to implement that at a local and national level. At a national level, very much the objectives are measured against the survey data that I'd mentioned earlier. So they're measured against crime statistics, and they're measured against the Scottish Crime and Justice Survey and the Scottish Attitude Survey. At a local level, Violence Against Women partnerships have been charged with the responsibility of trying to benchmark their progress against quality standards and against local indicators that have been developed as part of the Equally Safe strategy. Some of that is hampered by the fact that the systematic ongoing collection, analysis and interpretation of data that's required in order to make those decisions that I referred to a few moments ago is very poorly implemented in many areas. It does represent a challenge trying to link across different data gathering systems. It's very much problematic in trying to shape an integrated and coordinated response, as well as trying to identify the needs of different groups and populations. And I think one of the issues that Violence Against Women partnerships have encountered is the difficulty in gathering data from administrative sources that can help them shape an accurate picture of what's happening locally within their areas. And one of the kind of key issues that has been highlighted in the guidance and in Equally Safe is the need for us to take a gendered analysis to the application of data. We need to disaggregate data not only by sex, but also by understanding the gender implications that lie behind that. So, for example, it's not enough to count the numbers of women and men who are using our services. If I use alcohol and drug services as an example, we can count how many women and how many men use those services. But we also need to overlay that with an understanding that their gender roles have a serious impact on the pathways into developing problems with alcohol and drugs, and in shaping and informing how they can respond to do that and to find a way out of that issue. So the imperative really in looking at the collection and analysis of data is that it's disaggregated by sex, but also that we bring a gendered understanding to the gathering of that data. The guidance outlines a couple of different approaches to the response, both in the short term and in the longer term, in relation to data collection. So at the moment, we're aware that there's a number of efforts to collect data across different organisations. So the police and third sector organisations, for example, are collecting statistics on the numbers of reports of domestic abuse, the numbers of calls to helplines, the numbers of calls to mental health lines and so on, that give us some idea of the level of need in the short term in relation to data. What's important, I think, at the moment is that there is a clamour for data. There's definitely an understanding of the need for us to get information in the short term to help us find our way through this unprecedented situation and to find a way out of that as we move to transition. And I think what is important for us at the moment is not to create additional needs or demands on services, but look at the way we can harness our collective efforts to ensure that violence against women is included in existing data collection processes, such as those being agreed by Solace and COSLA. In the medium to longer term, however, I think this provides us with an opportunity to look at the existing mechanisms we have for collecting and analysing data and to identify where we could improve upon them. Whether we can find ways of setting up systems so that we can combine data from a number of sources, so to avoid the duplication, but also to ensure that we coordinate and integrate our response. The Violence Against Women partnerships and the quality leads, I think, would be instrumental in leading the discussions around what those systems could look like and in helping to shape systems around data sharing and information sharing protocols. There is undoubtedly a broader recovery data and intelligence focus underway, and I think, again, it's important that we integrate the issue of violence against women within those processes to ensure that it doesn't get obscured or hidden. One of the difficulties very often is that when we look for data on violence against women, we only look at specialist services in terms of referrals to, for example, Women's Aid or Rape Crisis or to perpetrator programmes. It's really important that what we do is coordinate our efforts across other data streams. So when there are anti-poverty initiatives, for example, that we ensure that we build in data queries around violence against women within those. Similarly, within the homelessness and alcohol and drug use and offending streams of work, it's important that we include that. And finally, throughout all of this, there is an imperative to ensure that we maintain the highest standards of ethical data collection and storage. The need for confidentiality doesn't need to be stressed here. I don't think. I'm sure that you're aware of the need for sensitivity and anonymity around that. But I think in taking forward our attempts to develop combined and more integrated systems for gathering and analysing data, we have to ensure that that has primacy throughout. In terms of the role of elected members like yourselves in taking this forward, I think one of the most important aspects to this would be the questions that you ask. Very often the questions around violence against women in relation to data and information only come through certain routes. So, for example, violence against women partnerships are required to report on that. I think it's really important, if we look at the different ways through community planning and other systems that data are being presented to elected members such as yourselves, that the question is also foremost in your mind around where does violence against women sit within these different areas of work, and am I sure and convinced that they are being highlighted appropriately and responded to appropriately. Thank you very much for your time.
Thank you very much. I really appreciate it. What we're going to do now is, if I can just bring back all the speakers onto the webcams. We're slightly running over time, but I really do want to put some questions to the speakers. So I want to try and take at least 3. Question number 1. For a member that's living and is a member of Highland Council, what extra support and help could be directed to the likes of Highland Council, but other councils with demographic challenges? Who wants to take that one?
Hello, hi. As part of the Scottish Government's package of support, Frontline Violence Against Women Services have received additional funding to ensure that frontline services are continuing to operate and can be responsive. Obviously, the way that, as was mentioned earlier, the way that those services are being delivered has changed, and obviously, as I mentioned, the current pressures, obviously under the current regulations, mean that we're facing a lot of challenges, and those frontline services are also facing a lot of challenges in ensuring reach into homes, particularly. So there has been additional resourcing made from the Scottish Government to local areas. The areas that you have highlighted obviously have considerable geographic challenges, and part of the purpose of the guidance is to look at building on what already works in local areas and to enhance that and to support the strong leadership that's already being shown and the strong quality of coordination and multi-agency responses around potential victims of violence against women and girls, and particularly in relation to holding perpetrators to account. And that's not a full answer to your question. There are in terms of additional financial resource at the moment, beyond what has been invested by the Scottish Government in those frontline services, unless Joanna, you can think of other areas where there's been additional investment, you can. That's good, but in relation to our frontline, in relation to our local authority services, at the moment, particularly in relation to VOG, this has not been the case. Joanna, can I pass to you?
Yeah, sorry, Kate, I wasn't nodding at additional investment, but I suppose I was thinking more in ways that we might be able to support this. So as part of our regular engagement with members of violence against women partnerships and other stakeholders, one of the things that I think we could do was to begin to capture some information about what is the unmet need, where do they anticipate additional resources being needed, and then use that to put together some sort of case or build a bit of a picture to identify what resources are needed in the short, medium and long term. And the messages that we've had from the Scottish Government and other stakeholders is that they very much want to be hearing that information. So perhaps we can get in touch with the Violence Against Women Partnership lead within Highlands and within other Highlands and Island local authorities to start building up some of that data and put together some sort of position or briefing on what future resourcing might have to look like.
Okay, thanks very much for that. This is a question for yourself, Jo. So you mentioned robust criminal justice. Police and, importantly, sheriffs on board with this?
Yeah, absolutely. The police have been doing huge amounts of work and sharing similar messages about the need to ensure that perpetrators are identified and held to account. There's been a massive amount of training that's been undertaken to make sure that police are able to intervene appropriately and identify perpetrator tactics linked to the Domestic Abuse Act that came out last year. In developing the guidance, we also consulted really closely with Community Justice Scotland, who hosts the Caledonian programme, which is Scotland's accredited perpetrator intervention. And they were very helpful and supportive as well about making sure that perpetrator interventions remain robust. A lot of those, as I mentioned, have had to move to virtual support, but there's quite in-depth guidance about how to go about doing that and providing high quality support during this time.
Thanks for that, Jo. probably final question, as we are really running out of time here. How many local authorities have robust housing policies for supporting women and girls suffering domestic abuse? Who wants to come in on that?
I can come in and say that, quite honestly, I don't know at the moment. We know that there's been a lot of guidance published about what robust policies look like, and we know that a lot of local authority areas have signed up to pledges about developing housing policies. That's certainly something we could capture more information on, if that would be useful for elected members, as well as potentially identifying some examples of good practice that we could look to share if there are areas who maybe don't have policies in place at the moment, if that would be useful. Katie, I don't know if there's anything you want to come in around that.
Yes, there is. I just want to assure members that there are discussions ongoing at the moment within the context of the resilience partnerships, the housing partnerships, which are referring to domestic abuse and a response to violence against women and girls. There is guidance that's been produced by the Chartered Institute of Housing and Scottish Women's Aid with support from COSLA and other organisations, and that is very much part of the guidance that we launched yesterday, the guidance that we're here talking about. That identifies really clearly what a solid policy looks like, and what we are hoping all social landlords will move forward to develop. Obviously, in this very intense time, we want to ensure that key decisions are being informed by a knowledge and understanding of what good, what excellent, and what protection looks like within the context of social housing providers. And we need to ensure we keep our eye on that ball, which we are doing, because obviously really key resources like refuge sit at the very heart of these conversations. So please, thank you very much for raising that question.
I think we'll have to finish up there. Thank you very much for taking those questions. Really appreciate it. Apologies, there was a few more questions there coming in, but we are just short of time. But we will, I'll fire in those questions to our speakers, and we will get responses to all those questions back to those of you that have asked. I will also share the slides from today, as well as the webinar recording will be going online as quickly as we can get it transcribed. I would just like to finish up by saying that if you have got any further questions or you'd like to get in touch with us, please do so. There's an email address on the slides that I'll be sending you. You can also follow us on Twitter, Local Councillor IS, and we've also got the Knowledge Hub group that COSLA set up on Scottish Elected Members Coronavirus Network, where there's opportunities to share good practice and have discussions in a safe online space with other elected members. So there's a few platforms and avenues for you to continue today's discussion. And finally, just thank you very much to both Katie Brown, Katie Cosgrove and Joe for your presentations. I'm sure members all really appreciate it. Thank you all and enjoy the rest of your day.